The rhabdoviruses are also enveloped negative sense strand RNA viruses, and the major human disease in this group is rabies. Rabies is an infection that is endemic worldwide. It's found in every continent except Antarctica, which makes sense because not a lot of things are exposed to what goes on in the rest of the world. There's a lot of isolation there. And also Australia. So that's kind of interesting. You might remember a few years ago, maybe more than a few years ago, when Johnny Depp was married to, what's her name? Oh, Amber Heard. And they tried to, I don't remember which one of them was filming a movie there, but they tried to bring their dogs into Australia. And Australia was pretty much like, if you don't take your dogs out of this country, we are going to euthanize them because they have such strict rabies control. So they tried to sneak them in on a private jet instead of go through the normal process. What happens with rabies is that the virus gets inoculated into the body, most often, almost always, through an animal bite. When the virus is inoculated through the bite, you'll have viral replication in the muscle. The virions will enter the peripheral nervous system and begin to move up the nervous system. They will continue relatively slowly to make their way up to the spinal cord. Once they get to the spinal cord, the virus gets a lot more rapid in terms of the progression of disease. So you'll have infection of the spinal cord, brain stem, cerebellum, and other brain structures, and descending infection into the eye, salivary glands, skin, and other organs. And so as the virus replicates in the salivary glands, that's when you get animals that are foaming at the mouth. And because it's in the brain, you have that aggression, loss of inhibition. So animals are no longer fearful of people. They'll come up, they'll bite, and their saliva is just full of virus. And so that's how it spreads. In the US, rabies is pretty rare. I pulled this data from the CDC just a few days ago, and there has not been a human rabies case in the US since 2018. That's good. Generally, prior to that, we would see 1 to 4 cases every year or so. So I cut off this table just because the table was too big, but it goes back a little bit farther. And what I want to highlight here is, well, a few things. But first, this patient who survived. You see, everybody else has a date of death, but we have a survival. And what they do for these patients who survive after the onset of symptoms, they call it a therapeutic hypothermia. They really lower the body temperature to basically almost induce coma. They also do induce coma, but to halt the viral replication and damage as much as possible. And then they try to control the virus through what's called post-exposure prophylaxis. So basically giving preformed antibodies, giving a vaccination to help induce the production of antibodies. And they call it the Milwaukee protocol. They try it on any patient that pops up with symptoms, and it almost never works. So it's a really dangerous infection. One of the other things I wanted to highlight on here is this patient right here. So a patient who died on September 1st in 2011, a male who died of a rabies virus variant from a raccoon. He was a hunter. But the thing is, when he died, they had no idea it was rabies. I've read that they thought it was a drug overdose. I've read that they thought it was seizures, but nobody thought rabies. Okay. The other thing that I want you to notice right here, he was an organ donor. So we have this patient here who died in 2013 because he had received a kidney transplant. And the strain of rabies that he died of was from a raccoon in the eastern United States. So actually, the reason that this original patient, this 20-year-old male, was diagnosed with rabies, it was actually way post-mortem because the recipient of his kidney died of rabies. There were other organs that were transplanted, but luckily only this patient has died. And this is not the first time this has happened. So it has happened at least twice in the US. It's happened in other countries as well, that an organ donor has died of rabies and it was not diagnosed as rabies. And then the patients are given organs, and sometimes those patients die of rabies. So what you do see here, mostly exposure, contact, bats. This 6-year-old male was a really sad case. The parents knew that he had been bitten by a bat, and instead of taking him to a doctor to get a rabies vaccine, they just tried to wash it with bleach and hoped everything would be okay, and unfortunately it wasn't. Bites, dog bite in the Philippines, unknown contact in Guatemala. But a lot of these are because people were bitten in other countries, not necessarily here. But it is still present in our wild animals in the US. So here was the headline from 2004, rabies-infected organs kill 3 patients. This was the one, I think, where the patient who died and was the organ donor was someone who had a history of drug use. And so when he came in with the symptoms of rabies, which we'll talk about in a little bit, nobody was surprised. They thought he had a drug overdose. This was the 6-year-old boy, died after being bitten by the rabies-infected bat. And this was from a few years ago, a confirmed case of rabies in a cat that bit a person in Fresno County. So it's not that we don't have rabies, it's just that most of the time people don't get it. So in the United States, the most recent data I could find of wild animal surveillance was from 2018, and that the most common wild animal vector is actually bats. So this figure is a little bit older, and it's from your textbook, and it shows that raccoons were the most common, but actually surveillance more recently has shown that bats are the most common. The most common domestic animal vector, cats. And that's the same as with this. Okay, super weird. They find cases in cows and stuff too. I don't know what happens with a rabid cow, but a rabid cow. Worldwide, there are approximately 60,000 deaths annually. The majority of those are in India. And like 99% of people who get rabies worldwide actually get it from dogs, even though in the US, cats are the most common domestic animal. Here, we have really strong rabies vaccination programs. And in the US, we tend to not have nearly as many stray dogs as we do stray cats. The World Health Organization estimates that 10 million people a year receive post-exposure treatment. So because the rabies virus moves so slowly from the site of the bite to causing symptoms, if you are bitten by an animal and you are either unsure of its rabies status or suspect that it could be rabid, you can get a vaccine, post-exposure prophylaxis, a post-exposure treatment, and that will protect you. It gives you enough time. Once symptoms have developed, it is generally too late. In the US, it's estimated that anywhere from 30 to 60,000 people a year get post-exposure prophylaxis. So the reason that we can do post-exposure prophylaxis is because the incubation period can be a very long time. So don't play around with a dog bite or a cat bite or any sort of animal bite. Just don't play around with it. Go tell your physician, insist that you get a rabies vaccine, because otherwise you will almost certainly die. So between 2 and 10 days when you first start developing symptoms, Fever, nausea, vomiting, loss of appetite, headache, lethargy. What does this sound like? Sounds like the flu. So flu-like symptoms. And then it goes into the neurological phase. Hydrophobia, it doesn't mean you're afraid of water. It means you can't drink. You can't like swallow water. You have pharyngeal spasms, hyperactivity, anxiety, depression, loss of coordination, paralysis, confusion, delirium. I'm not going to include a video here because I find it very depressing. But there are plenty of videos on YouTube of patients who have rabies, and you can see them spasming, you can see them trying to drink, you can see like the anxiety in their faces. And the reason I find it very sad is because those patients died. But if you're interested, you can totally find those videos on YouTube. And then we see coma and death. So once symptoms progress, you see it's relatively quick, less than a month from symptom onset to death. Diagnosis is usually on the basis of symptoms, but as I've mentioned, that occurs far too late for treatment. So you can do post-mortem analysis of the samples, looking for things like cytopathic changes. You can do the reverse transcription PCR, you can do ELISA. But again, I can't emphasize enough, just don't mess around with an animal bite. It's not worth it, because the slow progression of the disease can allow for that post-exposure prophylaxis. So it's one of the few infections that you can get bitten and still get a vaccine and be okay.